In this video, let's talk about outer hip pain. Hi, welcome back. This is Wei, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness, and performance. Right. I've been getting questions, and one of those is actually asking about the pain that's on the outside of the hip. And hearing this, I'm coming from more a layman kind of perspective. So when they talk about the front, they talk about the back. It's quite straightforward. So when they talk about the outside, I'm just going to be focusing more on the lateral side of the hip. Okay, so generally there are two muscles which I'm gonna help you locate those muscles that's affecting the area on the outside of the hip. And let's go through with the 3D model so you understand what actually are the muscles that's on the outside of the hip, and that can cause some form of pain, soreness, achiness around there. Alright, so I just want to show you quickly over here the muscle that's on the side of the hip. So if we are really on the side of the hip, because of this 3D model, the hand is actually blocking. So I'm going to shift the body a little bit, which is coming from a slightly angled position this way, and later on from this side. Okay, so if you look at it over here, if we were to zoom really in and beyond the hand, let me see if I can do this. No, forget it. Okay, so because of the hand, let me just shift it over here. So one of those muscles that's on the side of the hip, this is basically your hip. Okay, and on the side, you actually have got this muscle over here. A lot of people still don't recognize this as a muscle turn band, right? So this is basically your TFL muscle, Tensor fasciae Latae, okay? And this muscle, this muscle's tendon is actually then connected to the side of your knee, which is what most people call the ITB, okay, your iliotibial band, right? So recognize this is actually on the side of the hip, and this guy can actually cause a knee problem if it gets to a certain level of tightness or strain. Okay, so later on you will see actually how you're actually supposed to locate these muscles, right? So this is the guy that is slightly in front, although on the side of the hip, this guy is slightly in front, as you can see. Okay, so still at the side of the hip. Now this is still your hip. This is still your hip bone. Okay, and then on the side we have this guy. Okay, this is if you've seen my previous video, I call this the second brother. This guy is the big brother. Okay, this is not on the side, but just to give you some reference. Okay, because they share the same name, and his name is basically it's called the Gluteus medius, right? So this guy is also on the side, and as you can see, again, your hip bone, right? And not just him, and if we were to go slightly deeper, if we were to remove some muscles, you can actually see that there's actually one more guy that is just hiding behind, your second brother. And if I were to further remove, and there he is, this is your third brother, which we call the gluteus minimus. Okay, so this guy can also give you some form of hip pain on the side or hip soreness on the side if it happens to be this guy. Okay, so these are the possible muscles that can create hip pain on the side, right? So there you go. That's what you will see when you look at the 3D model. And next, let's show you where you can actually find these muscles and what you can actually do to help yourself relieve a little bit, and that includes some form of stretching, that includes some form of releasing of the muscle. So what you want to do here is to locate the side of the hip. Okay, so this crest, basically you can find that it's like a bowl shape, which is on the side of the hip. So if you're rolling it upwards, you will start to feel the side of the trunk. That's where you don't want to be pressing on. You want to be going downwards. Okay, so let me show you a little bit more. And once you go downwards, if you shift your fingers a little bit forward, this is where the TFL is. Okay, so if you rub around and you feel like there's some soreness over there, that's where it's giving you the soreness. Now this over here, it's more from the back, which is what you saw earlier on. This will be your glutes medius and your glutes minimus. Okay, so they're very close by, so just be careful. And what you can do is to help yourself relieve, if your fingers are not strong, you can use a tennis ball. So when you locate the muscle, what you want to do is to use the ball and to just lean into the wall. Okay, this way you can feel some relief. Just gonna hang in there for about 20 to 30 seconds, and then you can also shift the tennis ball back to your glutes medius. Right, and as for the stretching, what you want to do is to use a piece of wall beside you, and that side that you're trying to stretch, you have to put your leg behind. So the stretch will come from the side once you lean towards the wall. So the shoulder first and then the hip. Right, so you have to adjust a little bit. What you saw just now was me trying to adjust. Okay, bringing my leg backwards, shifting my body forward, shifting my body backwards. This way, you can then really feel the difference for the TFL and the glutes medius. So there you go. That's how you want to stretch those muscles, and you want to get the glute medius, the glute minimus, the TFL, the tensor fascial latae, to get the stretch. You have to be able to find the stretch around the area, and if not, you got to adjust a little bit. I realize generally you got to put yourself in a certain position, but you have to try to play around a little bit, whether you're leaning forward, whether you're leaning backwards, whether you are putting your leg a bit across more, because for some cases or some instances where people that I'm seeing, they're not careful, they are actually stretching on the side of the trunk rather than the hip. So you have to play around a little bit, but you understand that the stretch is going to come from the side. Okay, and that's where you want to try to get the stretch done. So for some people, or for you, you're watching and you try to do this exercise and you can't feel the stretch, remember what I say, you have to try to play around a little bit. It's not like it's the first time at the first go you will get the stretch, because even people in front of me, I have to get them to try a little bit so that we find the right position that they're supposed to be. Okay, so that's really all I have for you in this video. So if you haven't clicked the like button, I'll need your help, because this way YouTube will actually show this video to people who are actually looking for videos to solve the hip issues. And if you haven't subscribed to my channel, please do so. This way, and also the bell button. This way, YouTube will notify you when I post a new video. Okay, so same thing, if you have any questions, please post them in the comment section below. And if not, we will see you in the next video. And I will see you in the next video. And in the next video, we'll talk about sore hip. So basically, some people are feeling some soreness around the hip. We're gonna talk about that, and I will see you soon. Take care. Bye bye.